Thank you for joining us for this special series of This is Getting Old, sponsored by the 2020 George Washington University's University Seminar Series. Towards Age Friendly is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today we're going to be talking about how to age well, and specifically talking about the role that integrative medicine plays in healthy aging. And I'm joined today by Doctors Mikhail Kogan and Leigh Frame. Welcome.
Thank you.
So before we get started, I would like for you guys to introduce yourself. So maybe start with you, Leigh.
Thank you for having me. Very glad to be here and to be talking about this topic. My name is Leigh Frame, and I am the Program Director for Integrative Medicine, as well as the Executive Director for the Office of Integrative Medicine and Health at the George Washington School of Medicine and Health Sciences.
Okay.
And I'm Mikhail, and people often call me Misha Kogan. I'm Associate Professor of Medicine in Division of Geriatrics and Palliative Care. I'm also Medical Director of GW Center for Integrative Medicine and Associate Director of the Geriatric and Integrative Medicine Fellowships.
Okay, well, I appreciate both of you being here. I think this is a topic that a lot of people are interested in and maybe aren't familiar with what integrative medicine is. So I guess let's start with that basic question. What is integrative medicine?
That's a great question and a great place to start because we have to define it. And you know, it's one of those terms that people don't often fully understand, even when they do understand it. So I think even if you think you know what integrative medicine is, this will be helpful. The most important two aspects of integrative medicine are one, that they focus on the whole person and their whole lifestyle. So looking at all aspects of their life, their support system, their mind, body, and soul. So it's all inclusive and it's kind of a systems approach to health and wellness. The other aspect is that it uses any evidence-based therapeutic available. So that includes anything you might get from a non-integrative physician, so antibiotics, vaccines, surgery, anything that you would need on that realm, but also things that maybe you wouldn't get in that setting. So something like yoga therapy or acupuncture or support with herbs or different nutritional programs, such as maybe intermittent fasting. These are things you wouldn't get if you went to a non-integrative provider, but because they have evidence behind them, we can use them in medical care.
Okay, anything to add to that?
Yeah, I mean, I would also say that there's also a component of, in addition to differences in tools, I think there's also I would say a pyramid of treatment that's somewhat different. I mean, we typically try to start with non-invasive, non-surgical, non-pharmacological methods, especially for chronic conditions that often don't even have a kind of a curative pharmacologic approach. And we try to center around trying to address the causality of a problem instead of trying to say, look, you have a high blood pressure, take the medication to lower the blood pressure. I mean, that's not actually solving the cause of blood pressure, but if your blood pressure is driven by mercury toxicity or excessive stress, I mean, you know, we could also try to address those underlying causes and see if the condition itself resolves completely.
Okay, so that actually also explains a little bit about how integrative medicine is different than primary care. So what are the types of patients or the types of people that come to seeking your services? Like, what are some of the typical things that they come for, and then what can you do to help them?
Yeah,
so I want to tackle this first just from the patient perspective, because I think I had a very typical experience of a patient. And it's part of the reason I got so interested in this field. I have celiac disease, but it took me 30 years to get that diagnosis. And unfortunately, that is not an uncommon story. And it's because of exactly what Misha was talking about, how people try to treat symptoms. And I had all these different symptoms, which may or may not have been clear. You know, I had joint pain, which could have been a rheumatoid arthritis. It could have been lupus. It could have been so many things that it wasn't. But they were so focused on these symptoms that they didn't look at the whole person and all the different aspects of my life that could potentially be contributing to this. And you may think ironically, but now that I know more about integrative medicine, not ironically, I was really diagnosed by my acupuncturist. because he looked at me more holistically, and we were talking about food and how I felt after I ate certain foods, and we started to put things together. And then eventually I did get diagnosed, but it wasn't until you step back and you look at the bigger picture rather than just the symptoms that I was able to get that diagnosis, despite the fact that I have a background in nutrition and I know a lot about celiac disease, right? It's not a clear presentation for the same symptoms with every person, so it's a little difficult to diagnose. And I think that's really common of integrative medicine, and I'm sure Misha can give us some specific examples.
I mean, I do think I was actually talking to somebody about this week, where a lot of times the expectation of the medical system is that I'm going to come to my primary care provider and tell them what problem I have, and if they don't give me a pill to fix it, when you say to someone, you need to look at your diet, are you being active, are you getting enough sleep, and people are like, that's too radical. But they'll take a pill, which could have all kinds of side effects and really isn't like what you should be doing. So maybe give us some other examples.
Yeah, that's a perfect segue into sort of what I wanted to add to what Leigh was saying is, the fact that we have kind of a pill for every ill, but the problem is a lot of ills don't really have any pills. And, trying to get a pill for every ill actually causes way more ill than any benefits. And we know that, unfortunately, among people over 65, prescriptions are the third cause of death, killing approximately 250,000 Americans every year, just because the medications were prescribed correctly. I'm not talking about incorrect prescriptions, like opiate overdoses from overtaking medications wouldn't be even included in this 250,000 annual deaths. And so the problem with this is a majority of those patients who pass, unfortunately, are my patients are 65 plus, because that's just when side effects become more pronounced and more severe. So, I think what works for 30-year-old, 40-year-old is not necessarily the first best solution for 65-year-old. And I can give you probably hundreds of examples. I mean, one really good one is the sleep, right? I mean, especially with COVID, so many people have been complaining of sleep disruption, but think about how do we manage this? I mean, majority of the treatment is just go straight to prescribing medication, and we know that that's actually dangerous. Those medications in the long run, not effective, not FDA approved. There's not a single FDA approved hypnotic for more than 6 months of intervention. And yet they prescribe like candies, and unfortunately they cause increased mortality. But yet it's not necessarily that all of us physicians don't understand that. We actually understand that really well, but we don't have pathways within the system to do something different. Dr. Frame mentioned acupuncture, which actually would be my top recommendation for chronic sleep disturbance. The problem is the acupuncture has not been traditionally covered by Medicare until this year, until 2020. And yet even now it's officially covered, but good luck finding an acupuncturist who will accept the Medicare because the payment has not been yet set up. So there's practical problems. And even though the system itself, the primary care, is understanding a lot of this, but if you don't have that built into a system, you can't practically deliver that service. And I think that's when integrative medicine comes. And of course, then it's sort of immediate question is, well, how do you pay for all this? And I think that's a whole separate conversation, which I don't know if we want to have today, but it's an important conversation to have.
Yeah, well, I think the things that come to my mind are that we definitely have a healthcare system that is built on people being sick. If you're not sick, then people don't think that you don't need healthcare. And the preventive piece is what's missing. And I think the mindset of our culture also needs to change. So maybe let's talk about what are some of the ways you help people. It seems to me like by the time people get to you, they've already experienced that shift where they're like, look, I'm tired of going to the doctor and all they do is give me another pill, which then creates more problems. They're not really actually trying to help me solve the root of this problem.
Exactly.
I mean, and that's true wellness, right? If you're ill, and that's what dis-ease is. You're not at ease. So what are some of the strategies you guys use to help people do that?
So, I think it always starts with getting a really detailed understanding of the patient. You really can't work with someone if you don't know them really well. I tell you, I've solved more problems simply by asking their exact day's routine. I can probably give you thousands of different cases when the solution to a problem was found, not asking about anything medical, but asking, what time do you get up? What time is your breakfast? What do you do after breakfast? Once you start understanding someone's life and how that fits into their health, you find solutions left and right, not because necessarily it's not a rocket science. In fact, actually, I think what we do is the least technology oriented, the least interesting for medical students often, because it doesn't appear technologically or innovative, right? This is sort of like, oh, you ask them about their routine. Well, that's pretty boring. Yeah, it's actually often is pretty boring, but that's where the answer is.
Actually, that's innovative.
It is innovative. I was going to say that.
Sad if it's innovative, because that's actually, and in that sense, it's exactly the primary care. I mean, a good primary care doctor would know their patient better than some of the patient's relatives. And that's because that's sort of the value of understanding. And that's actually why I do what I do. I mean, I love primary care. And it's even though it's for within the healthcare system, how we define primary care, it's hard for me to often call what I do primary care, because, I may not necessarily have a setup for certain things, but I kind of view my relationship with patients as a primary care provider, because often what I have to offer them, even though it's not covered by their primary care insurance, but that's actually the value there, because they want to get better, they want to stay healthy. And even if it's not covered by insurance, they're still willing to pay for it because that's of value for them.
So I did have one question about population. So the show is called This Is Getting Old, Moving Towards an Age-Friendly World, but it's because when things are age-friendly, they're friendly for everyone. And you mentioned a couple of times that most of your patients are older, but it seems to me like, health and well-being kind of starts in childhood and adolescence. So do you treat across the lifespan?
I do, and it's actually exactly why I do that. I think in the beginning, I thought I'd get bored if I only see older people. Actually, that's not the case. You can actually get more entertainment.
The most interesting people.
Yes, exactly. They're most experienced and most fun. No, but because in order for me to understand some of the illnesses and some of the chronicity of the older age, I need to understand how it occurs in the younger age. So I actually see even kids occasionally. And I think most of the illnesses you can track to a middle age or even younger age. And understanding how to advocate for certain steps in care, and also more importantly, what questions to ask when somebody comes into you in terms of their chronicity. Dr. Frame brought up her own personal life, right? I mean, it's a crazy amount of time that passed before she got diagnosed, but trust me, I've seen cases even worse. I've seen celiac diagnosed in mid-80s.
Oh my gosh!
Wow.
And like the person was suffering for many decades, but and that's not actually quite. If I go around integrative medicine practitioners and ask them, almost everybody probably say, sure, I've seen a case like that. And that's just because it's not, conditions often, we have this famous thing in geriatrics, don't look for zebras, look for cows that look like zebras. Because the common conditions are often present in older age, extremely unusual, but they're still very common. So if you don't think in that framework, and if you don't ask, well, could this be that? It just looks this kind of zebra-like, but it's not actually a zebra. And that's also quite, I think, specific to primary care and to integrative. But unfortunately, quite often specialties are looking for zebras because they're kind of cool. You always look for some more fascinating diagnosis. I think in geriatrics, that's often just not the case.
I think there's a lot of things tied up into that. And, my background is nursing, and nursing is very, very much built on prevention, preventing illness. But to talk, the kind of the big buckets you guys have talked about are kind of sleep, activity, nutrition, mental health. That takes longer to do, and to help someone change those behaviors occurs over time. And so maybe a specialist is like, I want to come in, you're going to tell me the super complex thing, I'm going to solve your problem in 15 minutes and we're going to be better.
It would be great if that worked.
Yeah, I think a lot of setting of expectations and sort of adjusting the pace of work and explanation. It comes up at every counter for me.
Yeah, I was going to say, I think it's an expectation of patients too.
Yeah.
So let's talk about, to me, it seems to me like it would be great if people understood integrative medicine, and at the first sign or symptom that they would seek, someone, to help them find these other remedies. But at what point should someone decide to switch from kind of the mainstream thoughts and beliefs and come see you guys, or find an integrative medicine provider?
I don't think it's a switch. I think it's a kind of a transition of thinking that's complementary, so to speak. Most of the patients who come to see me, I think they either went through some difficult illness when they realized that the value of a standard healthcare system has failed them. And those patients, unfortunately, tend to be much harder to treat because sort of, they waited for a long time. The condition is now complicated. And yes, often I can offer things, but in reality, I wish they'd come 20 years before, you know what I'm saying? And then there's a second group of people who actually intuitively understand that, either from seeing experience of somebody else in their family or their friend, or simply just knowing that certain condition is just not going to be helped. I can give you a really good example. There's a quite rapidly growing awareness of ApoE4 mutation having a very high risk of Alzheimer's disease, right? And traditionally, healthcare system in neurology or memory clinic would say, well, there's nothing you can do about it. Well, it turns out there's thousands of things you can do about it, and there's a rapid increase in data that you can actually prevent onset of Alzheimer's with a good lifestyle if you have ApoE4. In fact, there are whole strategies now that evolved to do that. And they're not only not embraced by standard of care, they're often diminished in value and often said this is all doesn't work, which is not true. I mean, there's actually proof that strong anti-inflammatory lifestyle for somebody with ApoE4 is very beneficial, in fact, to the point where even CDC is now saying that. So there is no real discussion in certain ways. It's really more about, how do I center my thinking? And so if you start venturing outside of saying diagnosis, label, treatment, and you say, well, I have this risk factor, and what do I do with it? And I think those are the often patients that I love working with, because they're coming already fully primed. Like, I don't have to explain to them the value of what I do. They're coming in not asking, well, what do you have to offer me? They're coming in asking, well, so should I do intermittent fasting for 16 hours or 20 hours? Or should I, take the MCT oil or coconut oil? Those are the patients that we end up really clicking with, because they already grasp the core value. And I can just start concentrating on an actual knowledge that I can help them with, that they need to integrate into what they're already doing. A lot of these patients coming in, they're already like 80% there, frankly. Like, they already have done their homework, and I'm looking at some of their lifestyle choices and some of their vitamins. I'm like, wow, you're sure you didn't see an integrative doctor before me? They're like, nope, it's all my work. I'm like, awesome, So, and I think that's awareness is going to grow. I mean, I think in part of it is because the information is there, simply because of that.
Yeah, I also think it's a generational thing too, because you see the Gen Zers and even the millennials seem to be more understanding that a lot of the conditions of old age start in youth and really are additive over time. And so they're approaching their health and wellness very differently than the generations before them, where, it was sort of, well, I'll sleep when I'm dead, or, I'll worry about my diet once I'm older and I have to worry about my diet. That is no longer the outlook for the majority of young people. And I think it's going to really change how patients are coming into the healthcare system. So I'm hoping that will help change the way healthcare system is functioning, and that integrative medicine will become more kind of the norm rather than a division or a department over here by itself.
Right. So, and that actually makes me think, that I think we put a big emphasis on individuals making the right decision versus, we just did a podcast on age-friendly public health. And, so how is there any movement of trying to get integrative medicine out into the community? Because I mean, like, you think about obesity. I was talking to somebody yesterday and they're like, oh, you need to read the obesity code because she's like, even if you're not obese, it gave her a bunch of ideas about things that she could do to prevent that. You also mentioned Alzheimer's disease. I know that the folks that listen to this podcast are very interested in brain health, but is there some way to kind of get to integrate integrative medicine into our communities?
Well, you could probably spend a whole podcast on this and make sure that Dr. Bayumi comes on this podcast to talk with us. I think that's one of the most important questions of our current modern healthcare system. We know that the system failed chronic problems, chronic medical conditions. We know, and there's not a lot of discussions about that. I think everybody's on the same page here. It's just we're, like I like to give this analogy of a heavy train running on a track, right? I mean, you can't just transition it from one track to another, right? You have to construct a parallel track. It's a whole process of shifting. And so we're just at that beginning where we know where we need to go, but how do you sort of communicate to all the stakeholders? How do you tell the insurance companies, which are running in this mode of fee for service, that look, that's not really a viable model to keep people healthy? You can't say within fee for service at the end of the day, that's not going to work. It's a misaligned incentives. You can't fix this. You have to eventually get rid of whole pieces of our healthcare infrastructure. And sure, you probably can do it slowly with adjustments and a lot of shifts. And I'm sure Dr. Frame has a whole lot to add here. But bottom line, it's going to be very slow and painful at the onset. And unfortunately, I personally believe that starting with individual and working to tell the patients, we can't wait for you to see a massive shift. You do have to start within themselves. And I think that's also going to lead to communities starting to recognize this, and then sort of kind of a microcosm of healthcare where it's a community healthcare rather than on a larger scheme where I think the public health initiative on the statewide level is going to be way slower to come to fruition.
Did you want to add anything?
Yeah, I would totally agree with that. And I think the onus is also on the integrative community to push change. And that's something we're trying to do. The Academic Consortium for Integrative Medicine Health is kind of our overarching governing body, and they're bringing people together to try and figure out how do we make this happen? What models have worked in the past, and then what organizations can we partner with? So I'm a member of the American Society for Nutrition, which has had some successful lobbying, including getting the new NIH Precision Nutrition Research Initiative push. So there's now this recognition at NIH that nutrition kind of needs to be at the heart of everything that we do, and you can't just, prescribe your way out of a bad diet. So that has been a major culture shift. And now that we've got an NIH to do that, and we're going to have all this data, we can then pull that into conversations with health insurers, conversations with legislators, and really change the scheme. But like what Misha's saying is it's a process. And right now where we are in those early stages, we're collecting data, we're having conversations, and it's not going to happen overnight. But I think something that will help that happen quicker is if patients demand it, because that does seem to be something that really changes trends. And demand it to your provider, but also to your legislators. Let them know that, you're upset that Medicare is supposed to cover acupuncture, but you aren't able to find an acupuncturist who accepts Medicare. They don't know that's going on unless we let them know.
Or that Medicare only will cover nutrition consult if you have diabetes, chronic renal failure. Like really, it's probably kind of late to do a nutrition consult if you're already on dialysis. You really need to do it decades early. So I think that's
unless you're 65 and you haven't been diagnosed with celiac disease.
Well,
and then you got 20 years of like.
There is a basic, simple things like this that we can start working, and I think that's also a reason why you're talking to Leigh and I as part of university, as a faculty at universities, because we could have been in private practice making way more money, but yet we decided that our life goal is to try to not only see patients but also have some larger impact on the societal shift which has to occur.
Well, so I'm glad you brought that up, because I actually watched a documentary this week on Netflix, and it's called Beyond the Secret. It's called The Awakening. And if you remember The Secret, it had to do with like, whatever you think, you can manifest it. But then, they were like 20 years goes by, like it was a big fad in the 80s, and now no one thinks about it. But their whole point is that what people miss is that your head and your heart and your spirit, they're all connected. And when you live with your purpose, which is what you just said, like we could be making more money, but we connected our heart with our mind and then made a conscious decision to do the work that we do. And I think that people can stay healthy when all those things are aligned. And I think where we get off track is when there's a misalignment in some aspect. And I think that you're right, that you can't find those things until you really begin to have a truthful conversation with someone. Tell me what your day looks like. What type of social support do you have? You know, what are the things that you think about all the time? You know, because your thoughts determine your behavior. That's been my kick the past couple of weeks.
You see, like you just explained the kind of core principles of the working with a patient. I mean, you got to know all these details, and you, in a way, often the physician role there stops to being a physician role. You're really becoming a mirror for a patient. They're no longer using you as the, you know, you're suddenly becoming a reflection to help them to see what they're doing right and wrong, and then select the choices to move right. Because frankly, as I said, a lot of what we do is not a rocket science. I mean, eating well, sleeping well, exercising, and you know, staying positive and staying balanced in terms of nervous system, it's not all that complicated at the end of the day, but it requires a way of perceiving certain aspects of your life a little different. You know, they require you to be mindful of the weakness, strength, and weaknesses. In essence, you become your own psychologist, and you know, and that's not actually something intuitive. We often refer people out, like a good primary care doctor would have a very complex network of referrals, right? And most of the psychological help and sort of this mindfulness awareness, the reason we can't effectively do this in the primary care settings is simply because, I mean, insurance expects us to deliver patient care in what, 7 minutes or something like that? Like, seriously? Yeah. Like, come on. I mean, in 7 minutes, you can't even make it to the bathroom quite often. So, no, I mean, there needs to be a recognition of the fact that a good primary care will need to be delivered in some kind of a timeless, complex approach where a patient does not need to worry about how much time they have with a provider. You know, it shouldn't be based on in and out of the doctor's room. It needs to have a different system. And that's what I think Leigh and I were trying to explain, that I think the difficulties not only do we not have this system, but system is actually resisting to this change in a way, because it means that you can no longer have this reimbursement model to be effective. I mean, you have to change it, you know, it's because, you know, if you want to give patients more time, the provider has to be reimbursed for that time. And how do you do that? And, you know, and that's where often we have more questions than answers, unfortunately.
Right. Do you have anything to add?
No, I think that pretty much covers it. I guess the only thing that I would add is that there is a lot that people can do on their own as well. So even if, say, you know, you don't have the means to go to an integrative provider and pay out of pocket for some of these, we can provide you with resources. Like, for instance, the Mind Body. There's so many great free resources online. And actually, we have an event every Friday that now we have this huge archive of mind body practices that we've done for 30 minutes every week since the pandemic began. So it's almost a year at this point. Worth of content that's just freely available. And so you can take some initiative on your own. You can obviously reach out to an integrative provider to have them work with you, but it doesn't mean you have to necessarily spend a ton of money to do so. Because I think that's one of the unfortunate things, that integrative medicine also often gets characterized as being very boutique or you know, executive medicine, these sort of fancy models that means that the average person can't quite reach it. And I think that is unfortunate and actually kind of odd when you think about the things that we're doing, like what Dr. Kogan's been talking about in terms of approach. Talking with a patient is not particularly expensive, but it is counterintuitive to the current system. And so it doesn't fit in that model. And so you end up getting physicians who are operating on a membership model or a boutique model. And that makes it difficult for people to be able to afford that. But then there are people such as Dr. Kogan who do take insurance or will work with you to get reimbursed for insurance. You could see him, he can provide you resources, and then you can do very minimal out-of-pocket costs beyond that. So I guess just knowing that it's something that can be accessible to everyone, and maybe is actually more important for those with limited resources, you know, the ones who aren't going to be able to afford catastrophic care. Doing the preventative care now in the long run is going to be much more cost effective.
Yeah. Well, we already know there's a lot of disparities with access to healthcare, but then also, minority and poor populations are the ones that have more chronic illness for a whole host of reasons. And so I think a lot of what you guys have said, one thing I do want you to be sure that you give me the link to where people can find the weekly mind body resources, so that you can go to the blog on my website, melissabphd.com, and look at this, the blog that goes with this podcast, and get connected to that. But also we're gearing up to do this thing we're calling it the Age-Friendly Ecosystem Summit. And it's going to be a regional meeting between age-friendly Montgomery County, age-friendly Hyattsville, age-friendly DC, age-friendly Alexandria and Arlington, to pull people together to look at, and I think the integrative medicine, you guys will be great partners, because it has to do with, if you think about exercise, what needs to happen in a physical built environment? Well, your city council is the one making those decisions. Where we put a park, which sidewalk do we repair? So far as nutrition, like where are those services and resources for people in this community? Because again, like in order to age well, you have to start early. So
Right.
It's not just about older adults, but I would love to invite you guys to join us for that. It'll be May 4th and 5th, but we're going to have, but this podcast, we can also include, I probably will just include it because I think it's a great complementary piece to some of the other like policy things that we've been talking about. And it really is about health and well-being.
Excellent. We would be happy to help support that. That sounds like a great initiative.
Yeah, and from our end, we've sort of tried to work for the last couple of years with several, specifically DC area for starters, payers. So we've had a multiple conversation with the AmeriHealth, which is a local Medicaid provider. It's one of the three. It's actually the largest DC Medicaid provider, and so we've been negotiating contract with them to start offering some of the programs in a group format where we can bill multiple patients simultaneously, but the program itself will deliver basically a coaching and counseling, and whether it's nutrition and exercise. And it's not just, you're not just sitting there and learning about, you're actually doing it. So for example, if it's a 2-hour class, for a half an hour, 40 minutes, we'll do a meditative practice of different kind through each class. And then we'll cover a specific topic. And so this was all started through the healthaim.org, which is a nonprofit we started in 2014. Unfortunately, COVID put a major wrinkle. So we're trying to sort of revive this, but Dr. Frame and I as board members, we're trying to sort of see how this can, in the long run, get straight into the payers. I think without getting Medicare, Medicaid dollars for this, it's going to be a lot slower. So if we can figure out how to do this practically and then show the rest of the country, I think that's also going to be very helpful. And there are other places in the country where this is attempted. And so we're not obviously the only one. Dr. Frame mentioned consortium of academic health centers that's been very aggressive at trying to do it in different academic institutions across the country. And some places have been very successful. Boston University, Cleveland Clinic, different places.
Okay. Well, so as we finish up our time here together, you guys also have a podcast. So maybe, we'll finish out by just telling people how to connect with you and how to connect with your podcast and this weekly mind-body connection work that you're doing.
That sounds great. So to start with the podcast, it is GW Integrative Medicine. You can find it anywhere you get your podcast or on our website, which is actually pretty easy to find. Our acronym is OIMH, the Office of Integrative Medicine and Health. And if you Google OIMH, we are the only ones that pop up. So you will find us there. You can also follow us on social media at GW Integrative Medicine. We're on Twitter and Instagram and LinkedIn. You can follow me on them as well. I am at PhD_Leigh. And then I know Dr. Kogan is on there as well.
Yeah, so our center, the Integrative Medicine Center, is www.gwcim.com. I also do see Medicare patients through the university, and that's gwdocs.com. It's a big website. People have to find me there. And I'm also on Instagram at Mikhail Kogan MD, and as well as on Facebook, and I'm not as active on Twitter. Leigh is trying to push me to be more active. It's wonderful. Thanks for doing this. I think it's a really important topic.
All right. Well, I appreciate both of you being here with me today and helping people understand, how to age well and the role that integrative medicine can play in that. So thank you both.
Thank you.
Thank you.
Thank you for joining us for this special series of This is Getting Old, sponsored by the 2020 George Washington University's University Seminar Series. Towards Age Friendly is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Thank you for joining me for this week's episode of This is Getting Old, Moving Towards an Age-Friendly World. You can find more episodes like this on my YouTube channel, Melissa B. PhD, and don't forget to subscribe. You can also visit my website, melissabphd.com, and check out the podcast and blog section, because that's where I put all the hyperlinks and different things that we may talk about in any given episode. You can follow me on social media, Twitter, LinkedIn, Instagram, and Facebook. And you can also find the audio version of the podcast on iTunes, Stitcher, Spotify, and Amazon Music. So I hope this podcast gives you ideas of different things that we can do to move towards an age-friendly world, because when the world is age-friendly, it's friendly for everyone.